As I mentioned a little bit earlier, Sindisiwe Kwala, she's in Kwa Mahlanga, in Mpumalanga, Tsegofatsa Leapile in Mahikeng, Lemogang Foke in Mokopane. We've got it all covered for you here on SA Decides. Now, President Jacob Zuma, accompanied by various ministers, will descend on Mpumalanga's Kwaggafontein area this morning. The visit's part of the presidential Siyahlola monitoring program to check up on service delivery. The president will visit a local hospital to inspect service delivery levels before heading to the Kwaggafontein Stadium, where he will address the crowd. The Tembisi Lehani local municipality is anxiously awaiting the arrival of the president as he engages with community members. The visit is part of the government's Back to Basics 10-point revitalization plan aimed at promoting community engagement with the state as part of improving local governance. The community of Kwaggafontein is set to receive some new government houses, along with the unveiling of a new reservoir and a pipeline. Sindisiwe Twala and the team are on the ground to gauge the mood on the ground. Let's go there now live to Kwa Mahlanga in Mpumalanga. Sindisiwe now joins us. Sindisiwe, good morning to you. Is there a sense of excitement? Is there a sense of optimism ahead of the president's visit there today?
A very warm welcome to you, Peter, and the viewers at home. Yes, we were at the stadium earlier on today in Kwaggafontein, and people there are excited, to say the very least, to hear from President Jacob Zuma. The government has been doing numerous initiatives. Different ministers have been ascending in Mahlanga, as well as Kwaggafontein in the past week. And yesterday, the Minister of Energy was also here, and the day before, Lindiwe was also here. So ministers have been coming, ministers continue to be here, but right now I have the MEC for Health, Mr. Gillian Mashego from Mpumalanga province, who's part of the delegates that are going to be with the president, walking through different parts. They're at the hospital right now in Kwa Mahlanga, going to be talking to residents, looking at how the state of governance is, looking at how people here have been treated. But I have him. He's going to be explaining from his point of view exactly what Siyahlola, the monitoring campaign, has to do with the MEC, or rather has to do with the health department in the province. A very warm welcome to you. Could you please explain to us on how this Siyahlola monitoring campaign will have an impact in the MEC, or rather the health department in the area?
Well, from the health perspective, you'll remember that in terms of the white paper on the national health insurance, we speak about universal health quality service coverage. You'll recall that ours is primary re-engineering of the health care services, where we are saying now our approach should not be more of curative. We are now working on preventative approach, because that strategy of curing diseases is taking a lot of stress, is taking a lot of cost. So that's our strategy, is that our services must be more of preventative. You'll recall that the president launched Operation Pakisa 2, an ideal clinic initiative model, where we are saying our clinics should have all that is needed in a clinic. There should be a standby generator, there should be human resource in terms of capacity, there should be communication, all these aspects together in a basket. They will give you what you call an ideal clinic, where you have got nurses, you have got operational managers. Now you can say now the service that you are rendering there is in compliance with the core service standards, where we speak about the waiting time, infection control, cleanliness, all this aspect. So from us is on that part. If you look at the hospital now, you can see that we are moving towards there. You look at the environment, it's very clean. The inside of the hospital, doctors must be there in the OPD. People should not wait for quite a long stay in the hospital. Those are the things that Siyahlola generally says. Give people universal health coverage, which has got quality in it.
And then we heard that Mpumalanga was having a shortage of orthopedic surgeons. When the minister, Jeff Khatebo, was here, it was also mentioned. Are there steps in which the government has spoken of provincially, I know it's a bit premature, to help curb that or to help improve that?
What I did last year, I introduced what I called Operation the Same. Initially, when we started the project, we brought doctors from Gauteng, and we dealt with the backlog. But now recently we are receiving doctors from Cuba. Some of them are arriving. I can tell you that in terms of the backlog, we have done very well. What I did during the adjustment in October, November last year, I went and made a presentation in Cabinet, and Cabinet was able to grant me 39 million specifically to deal with the orthopedic backlogs. As we are speaking now, we have done very well and we are moving very well.
As you have heard, a number of ministers will be here, MECs, the likes, will also be here to help, or to rather usher the president in talking to people about the issues that are happening here, as well as going to the reservoirs and opening 2 different houses, also in Kwa Mahlanga and Kwa Mahlanga. Back to you in studio.
Let's go back now live to Kwa Mahlanga in Mpumalanga. Our reporter Sindisiwe Twala is there on the ground following President Jacob Zuma today. He's going to be in the area visiting a hospital in the area. He's also going to be addressing a crowd at the local stadium. There are also surrounding service delivery issues. Sindisiwe, good morning to you. Is there a sense again of optimism? Are the people feeling positive about the President's visit?
A very warm welcome to you once again, Peter. Yes, people are excited and more people are pouring into the stadium in Kwa Mahlanga, as we've heard. But right now, I also have someone else to be telling you more from his point of view. One of the dignitaries of following President Jacob Zuma's visit here in Kwa Mahlanga as well as Kwa Mahlanga. On my side, I have the Minister of Health, Acting Minister of Health, Mr. Ramahlodi, who's going to be telling us about the findings that were made earlier on by Minister in the presidency, Jeff Khadebe, as well as another minister that were here earlier on, as to how exactly they, as the health department, will plan moving forward from the Siyahlola campaign to implement those strategies. A very warm welcome to you. Yes, could you please clarify to us exactly moving forward?
I am Acting Minister of Health, but my substantive post is Minister of Public Administration and Service Delivery. So I'm here in those capacities. What we have since been briefed about is that we do need to reinforce the management systems, at least here at the hospital. Make sure, because we've got the doctors, we've got almost everything. There's a bit of challenge with water, but that has been taken care of. Now, we must just strengthen the capacity to manage, to use the human resource that we have here at this hospital. And if there should be any other things, obviously the President will initiate a process which allows us to come back as the various departments to come and implement the programs necessary. Minister Khadebe will still keep on coming because his job is to evaluate if the outcomes are okay. My job is to make sure that the administration works. So that's what we do. Thank you.
All right, Peter, as you have heard, he has made or clarified the fact that he's got 2 roles right now. He's looking at it from a public perspective and he's also looking at it from the health perspective. But I also have with me Minister Jeff Khadebe from the presidency, who was here 2 days ago, who was speaking to residents, who was taking the time to also speak to the license department about different things happening here and trying to find out if the service delivery is according to par. A very warm welcome to you once again.
Good morning to you and all your viewers of A97.
Could you please tell us, from your point of view, what Operation Siyahlola is?
Well, Operation Siyahlola, as you know, is a presidential project where the president, from time to time, he visits his communities, more particularly the facility, public facility, to see whether government officials are implementing programs of government. You'll recall that the precursor to the president's visit today was his interaction with the community of Kwaggafontein when he met them during a Home Affairs visit in Marabastad, so where they were complaining about the levels of service delivery. So that's why he has deployed various ministers, including myself, to see for ourselves what we can do in order to intervene to improve the quality of service. So today he's going to be seeing here in Kwa Mahlanga Hospital to see whether these projects have been done. You'll recall that the people complain about the shortage of water here in this hospital. But we're happy today because right now the president will be looking at the boreholes, which is pumping about 120,000 liters of water per day and distributing about 60,000 liters into this hospital, which means that the president has effectively intervened to solve the problem. From here, he'll be going to give houses, the RPP homes, where people were previously staying in shacks. Now, because of the government program through the Department of Human Settlements, those members are now beneficiaries of the service. And then the highlight will be interaction with the community in Kwaggafontein Stadium, where community members will be telling the president what the successes are of government, but more particularly what are the challenges so that they can be resolved.
As you have heard, Peter, a lot is yet to be seen. Ministers have, or rather said, what exactly the program is about, and people are anticipating to hear more, as well as from the president. Back to you in studio.